When people stare at me, they're looking at me like I'm an alien.
I had so many scars. A lot of people stare at me. It makes me not feel like I'm a human being or a person.
This is the largest birthmark I have ever seen on somebody's face. The cells in your skin grown out of control.
Well, if you could have one thing addressed, what would it be?
Seal the lips, that way I'm not, drooling on my wife when we're kissing or something like that.
I don't think you're gonna close this. It's really tight.
What have you done?
This is absolutely the last thing we want to see.
If we don't get this fixed quickly, it could ruin everything.
So you still have one case left?
I do. One more to do.
Hello.
Hey, what's up?
Hey, what's
How's it
happening?
going, guys?
Good.
It's
How
going
are
all
you?
right. How are you?
Good to see you. Good. So I have this patient coming in. She's a young mom, and she has this birthmark. And this is not your average birthmark. It's really large. It's on her face. This is Jordan Lopez. You can really appreciate, the size of this.
Wow.
And clearly, it's kind of growing, and you could see kind of how raised it is.
Oh, yeah. You can really see how much it comes off the face there.
As it grows, the top of it dies off and is that dark color. When it's kind of in between, it's that kind of greenish, kind of still moist. For all I know, the green could be from bacteria harboring under there.
Absolutely.
You have to be a little bit cognizant of the fact that there could be a cancerous transformation in any part of this. So,
Right.
And
Yeah.
the larger the lesion,
Yeah.
the higher the chance that it could convert at some point
Absolutely.
later in their life.
Yeah.
Right.
Clearly can benefit from an excision.
Well, the problem is, once you get it out, can you get it closed?
Yeah, without distorting anything either.
Yeah,
Yeah.
absolutely. And that is a definite risk here. But she's, a mom, and she's always thinking about her kids and taking care of them. But now it's time to take care of her.
Absolutely.
I agree.
Growing up, there were times I dealt with bullying and name calling and all that because I'm one of those people who look different. When people stare at me, I feel like they're looking at me like I'm an alien.
Good morning. Can we get 2 large coffees?
Thank you.
Thank you.
Is it good?
Yes. Caffeine. Are you nervous?
You should know this. You're my mom. This is my first surgery. My first surgery. And I don't really know how to feel about it because I've never seen myself without my birthmark. When I go out in public, I hide it with my hair all the time. I can feel the weight of my birthmark on my face. It gets pussy sometimes, and then pieces just fall off. It bugs me, like, out of the corner of my eye, it's just there, like, I can see it. So whenever that happens, I just start picking it.
Does it hurt when you pick it?
Yeah. It itches so bad. Like, I can't scratch it like everybody else scratches.
Your tongue is dry right now.
I mean, yeah, I can't scratch it like this. I have to go like this, I have to tap it. And when I do that, pieces fall off.
Used to not look like that, though.
Well, I know it used to be flat. They never told you if, like, hormones would help it grow or anything like that.
No.
That's crazy, because, ever since I had Marshawn, it grew. And you seen the changes. Everybody around me seen the changes, so.
Yeah. Every time you get pregnant and have a baby, it grows.
Yeah. I'm a stay-at-home mom to 4 boys. Since I started having kids, it's grown outward and basically crusting up and falling off. I was born with linear nevus sebaceous syndrome. Linear nevus sebaceous syndrome can be life-threatening. For years, it really scared me because I felt like it could kill me.
So it is scary. They're gonna take it off.
Oh yeah, I'm scared. I'm nervous. I'm everything. I'm really worried about learning how to accept my new self because it took me so long. to accept my birthmark. Like, I'm 23 years old. I'm just now accepting it. So now it's like, how am I gonna feel when it is gone? Growing up, it was really hard for me. When I was bullied, it made me hate everybody. Like, it was hard for me to make friends. Sorry, I'm getting emotional. But being bullied helped me toughen up. It got to a point where I wouldn't let people bully me. I wouldn't accept it. I still don't. So how do you feel about me getting surgery?
Kind of scared
Why?
because I don't know what's gonna happen. I mean, you're my only girl. But you're a grown woman now, so this is your decision, and I will stand behind you.
So we're gonna go meet with the doctor just to talk about if he can do it, when, where, how, all that.
All right.
The plan is to fly out to LA to meet Dr. Roostaeian. When I meet him, I hope he can give me the answers I'm looking for and is able to do the surgery that I'm looking for. It's been very hard for me to find doctors willing to help me because they've never seen it before. They don't know what it is, what it could be. I think it was more in fear of not knowing what they're dealing with or how bad it can be underneath. What if he can't do it? You know what I mean? What if he can't help me? That's something I always fear because I've been dealing with it for years now. If he can't help me, there is no backup plan. I would have to live with my birthmark. And I'm worried it could kill me. I'd be really sad if I couldn't get it removed.
Hopefully, this will be a good thing.
I hope so, because I'm tired of being rejected. I'm tired. Hello.
Hi,
I'm here to see Dr. Roostaeian. I've been waiting for this day for a long time. I'm a little scared, I'm not gonna lie, but nothing's gonna make me leave. I'm here. Oh, I'm nervous.
Me too.
I hope he can help me.
Hi,
Hello.
how you doing, Jordan?
Good, how
to
are
meet
you?
you in
Nice
person.
to meet you.
Hey, how you doing? Your mom?
Yes, I'm Mom.
All right, well, great to meet you as well.
Good to meet you.
It's good to have your support here, of course.
Yeah.
So, let's figure out the best way to help you.
Okay, so I was born with linear nevus sebaceous syndrome, which is this birthmark, and my eye.
Okay. Linear nevus sebaceous syndrome is characterized by these growths that are discolored and isolated usually to the face, neck, and scalp. She probably has a gene mutation that caused all this. The cells involved have grown out of control. How big was it, by the way, when she was first born?
It was like flat. Like all the growth that's on there now, it wasn't on there then.
It actually looked a little smaller too.
Okay.
Then I got pregnant and it started rising. And then once I had them, it got even bigger and then just started cracking.
Okay.
My last pregnancy is when it got the worst and it got really huge in this area, like everywhere but the middle.
Got it. Okay. Pregnancy causes hormonal changes, and this can cause these lesions to grow. She had 4 kids in a row, and that's exactly what happened. This thing grew substantially when she had all these pregnancies. And you have a kind of skin tag on that left eyelid, and has that been since birth?
Since birth.
Okay. Also, she has something called eyelid-ptosis, where her eyelid sits kind of low on that side. She doesn't have the normal mechanism. That's not something you'd want to tackle at the same time. That's something that you'd want to do in a second stage to get her eyelid in a more appropriate position. So is it okay if I do an exam?
Yeah, that's fine.
Okay, perfect. This is the largest birthmark I have ever seen on somebody's face. It's very ununiform. And it's very regular, very raised, flaky, crispy on the top, and softer as you get towards the bottom, kind of like peach cobbler. Unfortunately, does not smell good because, you know, there is bacteria in there kind of hiding away in those crevices. You can absolutely go septic from it, and that's, of course, life-threatening.
Delivery? You in?
I'm in.
I'm in. McSpicy. Medium meal.
Yeah. I'm in.
Come in, McCrispy.
I'm in. Yeah, I well fancy a fillet of fish. Expand your palate. We're in. Map delivery.
Big chicken sandwich. I'm in.
Oh, I'm out.
Watching a sunset like that on a date like this. What more could you want? With local restaurants, supermarkets and shops on Deliveroo, now just got even better.
Flora, the fragrance collection.
Tempur Pro, our most adaptive mattress ever. Born from NASA technology, billions of ultra-sensitive cells relieving even more pressure for ultimate comfort and support. Now available with SmartCool technology. Tempur, the future of sleep is here.
In the wild, everything is always in front of you. Sauvage Elixir, Dior.
You were sent to grab something in the pantry 20 minutes ago. But you decided to sneak in some Amazon Black Friday deals. Quick, Gary, the Piccalilli. Up to 40% off this Amazon Black Friday week. Starts Thursday.
A new season brings new upgrades.
Forgot your car?
I got something better.
Power Boost actives activated.
What? They boosted the bunny.
Hola! Only Duracell has Power Boost actives.
Kevin's Christmas proposal had been long overdue. A few weeks later, he was on his stag do.
Hello?
Katie, it's Kelvin. We've lost Kevin.
Calvin, you're his best man. We're getting married tomorrow.
Yeah, it's all gone pear-shaped. Bye.
What happened next, you'll never guess. He was given a lift on the Christmas Express.
Struth, Kev! I can see you down under. Where you been?
I went to Lapland, you know, for the dancing. Go on, Kevin.
It was full steam ahead. There was no time to wait. Would they get married? Or was it too late?
I was left in a bag in a phone box.
I wanted to know where my mum was and why did she abandon me.
She wanted you to be found. She did the best she could.
The whole story is not a fairy tale.
Gosh, oh, this is so complicated.
Oh my goodness.
You know, it is an absolute first. Long lost family, born without trace. What happened next? Starts Tuesday the 2nd of December on Really.
You got that, please!
Who's gonna be on this video? And what's it gonna reveal?
The Murder Tapes starts Saturday at 9 on Quest Red and stream previous series now on Discovery Plus.
I noticed there's potentially a little fluid in there, so I want to kind of get that fluid. All right. So yeah, if I press on the top here, you could see a little bit of fluid kind of coming up there. Is this hurting at all?
Not yet.
Not yet. I just want to get a good sample of this. And you've had an infection here before, huh?
Yeah.
How many infections have you had here?
I can't even tell you how many.
Okay. We'll definitely send some of this for culture. I think it is good to actually express some of this fluid out so it's not brewing under there. It makes sense she wants to get rid of this. Birthmarks growing this fast and this large can often harbor infection. This allows an open door into your bloodstream potentially, which is very dangerous. So the good news is that we have surgical options to address the issues that you have. All right, let's get these images up for you. All right. I would like to get as much of this cut out and closed as possible. And in that process, I think it'd be a mistake not to like make sure we got every last bad cell of it, right?
There could be parts hiding under the hair that I don't see.
Yeah, and here's the thing. I mean, luckily, it has this shape where we can kind of zero in from below, from the side, and from the side, and get this as small as possible. And then whatever we can't close, then we can replace that piece of skin and borrow it from somewhere else that is the closest skin match, okay? Now, when I go back to the front view, you could really see how this is higher. Okay, and let's see from this angle, maybe it's even more obvious.
Yeah.
You see how high that is compared to this side? We at a minimum need to see what it is.
Yeah.
A couple things I want to go over with you. The CTs and MRIs that you had back in Dallas. Thanks for bringing them. This is a CT scan that kind of shows you where you have this really large mass that's, kind of coming from your upper jaw into your nose.
That's huge.
It's not small. It's not small. Sometimes what you see at the surface is just a sign of something much more important going on under the skin. When I reviewed her images, I realized she had this really large mass under the skin, and that was a concern for sure because it can easily be cancer. Because this has never been biopsied, we really don't know what this is yet, but we need to find out.
I knew something was going on. Over the years, I watched my face shift and change in a drastic way. My biggest fear is it being cancer.
I know this isn't easy. I could see in Mom's eyes this is big news for her, and it could be scary. We don't know what it is.
Oh no, that stuff just scares me.
Yeah, it is scary, but if we wait any longer, it could be worse.
I know.
So you just gotta do what you gotta do.
Step one is to know it's there, not to ignore it.
Right.
And we're gonna find out exactly what it is by taking a biopsy. And then we'll see what it is and go from there.
Of course I'm scared. I have kids at home. I have 4 beautiful boys. So me having cancer, and what if I die? I think that's my biggest fear.
So overall assessment, as you know, you have the sebaceous nevus here that we need to remove and then reconstruct. My goal will be to downsize it as much as possible and get your neighboring skin to come together. Any areas that I can't, I'm gonna use a skin graft. Does that make sense?
Yeah, it does make sense.
Perfect. Last part is the eyelid. We can remove what looks like a red cyst on your upper eyelid.
Okay.
We're here to give you the best possible care and take care of the main issues and make sure we figure out the best care forward for you, okay?
Alrighty. You really comfort me. Like, I feel confident with you.
Thank you.
And I've never felt that way with any other doctor, so.
Well, that means a lot. We'll get this done for you.
I'm ready.
I'm ready too. This case will absolutely be challenging, given the gravity of the situation. Being able to get it all done for her is, not, I know, not gonna be a trivial task.
You need a hug? I love you. I'm gonna be okay.
So I have a patient coming in, Lewis. Lewis was riding his bike and he was hit by a drunk driver in a hit-and-run accident over 10 years ago. He sustained severe injuries to his face, his body, his hands, basically everywhere. The big thing that I'm worried about is how much muscle Lewis has left. They had to remove a lot of muscle that was dead at the time of his initial trauma. And there were parts of his jawbone that were missing and had to be reconstructed. So there's a solid chance he doesn't have an entire jawbone on that side. So I don't know what I'm gonna find when I go in there.
I have so many scars that a lot of people when I'm out tend to stare at me all the time. When you're out in public and someone's just like glaring at you, it makes me not feel like I'm a human being or a person.
Nervous?
I'm always nervous. You know that. Always nervous. Nervous, excited.
What's your pain level at today?
A 7.
What's hurting you?
Everything. I am in pain 24/7, 365 days a year. Never goes away. Where I feel it is primarily located in my face and a lot of times in my neck. It's rough.
All right, the doctor's ready to see you now if you want to follow me on back.
All right, sounds good. Come in, Shady. Oh, yeah, come in. What I hope comes from all of this is to just feel some sense of confidence in the way I look. It's a comfy little chair.
It is. It's nice.
If Dr. Ravello can't help me, because I'm not sure she can, I don't know what I'm going to do. I really don't have a backup plan on this.
Hello, hi. I'm Dr. Ravello, great to see you. And we have, of course,
Shelby.
Hey, Shelby. She's so happy. Oh, she's such a good ducky. Well, how's everything going?
Good.
Good? How are you feeling today?
Feeling all right.
All right, good.
Feeling all right.
Well, Louis, why don't you tell me a little bit about what happened and how you got to where you are today?
So I was hit by an underage drunk driver. I got shot up into the car through the glass. The rest of my face went through, and I had my lower jaw basically resting on the glass. That glass shot up through my jaw and cut through all the bone, the muscle, the skin tissue. When she decided to drive off, my jaw shot in the car, and I popped out, and she ran over my neck.
Oh my gosh.
They were pretty sure I was going to die.
This was an extremely severe injury. He's had a lot of trauma to his face, so this is not an easy problem. Did you have more surgeries after that?
Oh, yeah. I stopped counting when I hit 12. I've had way more than 12.
Well, if you could have one thing or two things addressed with the face, what would it be?
Definitely seal the lips, so that way I'm not losing food.
Because after the accident, I'm assuming that you lost a lot of sensation around the mouth there.
I had nerve damage and all kinds of fun things. We went to a Japanese food restaurant at one point, and that was the worst because it was such tiny little bites, so that I had just food everywhere.
And Adriana, how do you feel about that? Is that hard for you to see?
More so, I feel for him. I want, him to be comfortable.
I know it bothers her, but it really bothers me too. Drooling on her when we're kissing or something like that. The corner of my mouth actually will not close this corner here. The upper scar actually constricts and pulls on the rest of my lip to pull it up, which causes me to unfortunately drool or lose food out of my mouth, which my dog likes.
All right, let's take a look. Louis has a lot of scars. He has scars on his chin. He has scars along the jawline. He has scars on the neck and the corner of the mouth. And he's left with pretty significant defects. How tight does this feel up top, this scar that you have coming down this way?
It pretty much feels like it's just doing this 24/7.
Like it's just pulling up all the time?
It feels like it's just yanking on me.
That scar above his lip, it is really thick, and it really is pulling up the corner and the top of his upper lip. And then close your mouth as much as you can. When he did that, I could see that he did not have a functional corner of the mouth. There was no muscle function. It was just a band of scar tissue and scarred up skin. This is a problem because scar tissue does not stretch, so that's inhibiting the movement of the mouth. And open. I hate scar tissue. It pulls things in directions that they shouldn't be pulled, completely distorts the normal anatomy. Scar tissue's a bitch. It sucks. Nobody likes it. Louis has so much scar tissue that it really just makes the case much more challenging. And I'm not really sure what we can do to fix it at this point. Well, Louis, what I can see by looking at you on exam here, your lip actually stops right here and right here. The muscle kind of stops back here. So it's not even coming up to the corner, which is why you've really lost that function of the corner of the mouth, which, as you know, is causing you to have problems keeping things in. The muscle that goes around the lips is a full oval that goes all the way around it. And if you have a break or a scar, it can't function. It can't do its job, which is to close the mouth. We need to get that muscle back into better position. Right now, there's kind of an empty hole where that corner is. All right, so we're going to open up that area, identify the muscles that are still there, and bring them back into closer approximation. Is that something that you want to proceed with?
What do you think?
Yeah.
Great. Do you have any questions or concerns?
When can I kiss the wife? Or
Oh.
how long am I not to kiss the wife?
I would probably give that a couple weeks. Just the same.
And get a break.
Shush.
The biggest challenge going into this surgery is that it's very critical when we get in there to find muscle, because without it, I'm not sure what we can do to help him.
To those who might scratch day and night, to those whose skin may feel dried out even by water, try to take a shower with the new Sanex Skin Therapy and its patented amino acid complex for 24-hour hydration feel. Relief could be as simple as a shower. Certified by the British Skin Foundation.
Beyond the sea, she's there watching.
14 nights in the Caribbean from 1399. I'm gonna need a bigger bucket list.
P&O Cruises. Holiday like never before. Adult protected.
Just me keeps them kids in line. 3 little words.
It's dinner time!
Headsets down for some IRL. It's the OMG we all did smell. Zara's sorry, but she can't make it tonight. She's working late, she's proper chock-a-block. Yeah, right. Did somebody say just beat? Come on! Come on! Come on! Come on!
And you? What would you do for love? Miss Dior, the new Essence Dior.
With Vinted's new electronics category, you can earn with no selling fees, again and again. Sell pre-owned electronics today. Don't use it, sell it.
Mr. Q. At Mr. Q Casino, we tell it how it is. When players win, they love Q. When players lose, they hate Q. Oh dear. They love Q. Oh, he's not happy. They hate Q. Oh, love Q. Hate Q. Love Q. Oh no, hate Q. It'll grow back. Mr. Q, the casino you love to hate. We kind of love that.
The £5 meal deal from McDonald's. Cheeseburger or mayo chicken, fries, 4 chicken McNuggets, and a drink. But guess what? That's right, £5.
What do you value? If you ask us, variety is a good start, whether that's petrol or electric. Then there's comfort, wherever you go. And no one ever said, sorry, that's too convenient. And doing it all with style. That's a given. All for as little as this. A Moda. Value. Everything. Book your test drive now.
Thanks for everything, Al!
TUI, Atoll and Apta Protected.
Dunkable party food? Oh, stop it, M&S. Turkey Feast Toasties with a rich turkey gravy dip, ham hock, sage and onion stuffing, Emmental cheese. Oh, we've moved on. What are these then? Handmade paella bites, topped with a rich tomato sauce and a whole black tiger prawn. And fish and chips in a salt and vinegar batter with a pea and mint crush and a wooden fork. Classy. This is not just party food. This is M&S Christmas party food.
What if you could correct yellow tones in real life, not just on socials? Colgate Max White Purple Reveal with colour correcting technology instantly corrects yellow tones for whiter teeth right after brushing. Hello Purple, hello Shine, Colgate Max White Purple Reveal. It's new, it's glowing, it's the next step to your white smile. New Max White Purple Serum.
He's the auctioneer with the heart of gold.
You cannot not be amazed with it.
And now he's finding hidden treasures in Yorkshire's grandest estates to keep them alive.
Look at that bad boy.
Something goes wrong every day, and the upkeep's enormous.
I've spotted something already. That would sell. It's the sort of thing you only get out of country houses like this. I don't think I can do anything with the toilets.
Brand new Angus Ashworth Yorkshire Heritage Hero starts Monday at 9 on Really.
Step inside the repair shop as treasured toys are brought back to life.
Oh my goodness.
Weekends to remember at the repair shop. Sunday from 2 on Really.
So how are you feeling?
I'm excited. I thought I was going to be nervous, but it's not that bad. Not yet.
Yeah.
You nervous?
I think I'm way more nervous than you are.
It's not that bad. I'm ready. I've been waiting for this forever.
Hey, Jordan.
Hey, how are you?
You ready for the big day?
Yes, I'm ready. Are you ready?
I'm ready. I'm really ready. So today's the day of Jordan's surgery. The plan is to remove the big birthmark, fix the upper eyelid eyelashes, and then biopsy this mass in the mouth. Any other questions for me or anything else I could tell you or do for you?
No, I'm ready to go.
All right, well, let's get you back there, all right?
Thank you.
All right, yeah. I'll see you on the other end, okay?
Okay.
All right, perfect.
Okay, I love you.
I love you too, baby.
The biggest challenge in this case is trying to downsize the hole that we're gonna make after removing this large birthmark. And my real goal is to get as much of her own natural skin to meet each other, which is much better than a graft. A graft always looks a little bit patchy. It takes longer to heal, and I wanna try to minimize how much of that we need to do. I think we can get a lot of this closed, honestly.
Yeah, it might be, yeah. Now that I see it in person.
Yeah. I mean, this part's a little tight.
Yeah.
If I have to, I just cut here, skin graft this.
Yeah, you can do that.
Yeah. So going in, there's a lot of stakes to this surgery. The birthmark has, constant infections harboring inside of it, and that could be life-threatening. And so we don't want this to come back for her, so we got to make sure we get all of it. And then, of course, I got to biopsy that mass in the mouth because you never know if it could be cancer, and that's, of course, life-threatening. I got Dr. Panosi to help me out, which is awesome, and we're gonna go after this. Incision. The first step is the eyelid. So my plan there is to kind of cut out all that abnormal tissue. The upper eyelid's no walk in the park because it's really delicate surgery. So she had a skin lesion separating between the two eyelashes, so we cut that out completely in full thickness all the way to her inner lining of her eyelid. Now she has another little lesion of the inner eyelid that was a little larger. So we're gonna cut some of that out.
There we go. Let me just sort of set this up like this and this and just...
Yeah, line it up. I just want to get that gray line together.
Yep. Looks like you got it.
Let's
right
go ahead
there.
and get the tarsus together.
Yeah. Tarsus is the name of the cartilage of the eyelid. So that sort of runs, a very thin strip, runs from the inner corner of the eye to the outer corner of the eye. It sort of gives you that clothesline effect on the eyelid. It gives it some stability. Whenever we blink, it's those strips of cartilage on the eyelid, they touch like this. So if you didn't have it there, you can't establish a closed eye, and you would have a completely different appearance to the eye. I don't think it would be even very protective of the eye if you didn't have a tarsus. So it's a very critical element to put together again, because it's basically the structure of the eyelid. If you don't put it together again and you just put the skin back or the lining underneath back, then you're going to see a notch form right where that tarsus, that piece of cartilage, is gapped open. So it'll go like that. So it's not a great idea to leave it unrepaired. So that's what we're doing now.
The tarsal plate is really delicate. Putting that part together is really important. So we get through and then get the eyelashes together.
And it's already looking fantastic. It's perfect looking eyelid there now. Look at that. Boom. Like that.
Okay, yeah, I think it's good. Next.
Really cool.
So the next step is removing all of that birthmark. We're going to start with cutting off the top layers.
Get a little something to catch this stuff with. It's amazing. These things actually hurt too. They have actual nerve endings inside them that get sensitivity. Yeah. Look at that. Huh?
Those are like vertical growths.
Yeah. And these are just the outer layers of skin that just pile on top of each other off of these appendages
If you look
from the
close, it looks like hair almost. Like it has like little fingers, just like hair would almost. You see that? Almost like a carpet. I've never seen a birthmark like this big, this much vertical growth. This is really unusual. It kind of smells a little bit, doesn't it?
Yeah, it's like bacteria, musty smell.
So much bacteria has been brewing under here. It's not clean. So I want to get this top layer out so I can at least get a clean surface again. Okay. I think that's pretty good.
Yeah.
After we got all those crusts off, the next step is to get the large birthmark out. Ready to cut this thing out?
Okay.
So we kind of tag team cutting this out. You know, he started at one corner, I started the other. Like Lady and the Tramp met in the middle.
That's a great layer.
Yeah. Everything looks good so far. We're down to a fat layer below the birthmark. So it's definitely a good sign that, you know, the birthmark is in the skin and not going deep to that. Last little bit here. This is it.
She waited her whole life for this moment.
Our defect now is 14 centimeters, and all the way down here, 11 centimeters. Large, very large. We got a big hole here. We got a big hole that we gotta figure out how to get closed. Basically, I had to attack it from all angles. I start mobilizing a lot of the scalp both in front and behind the lesions. You gotta lift up a bunch of it, detaching it from all the deep tissues below so it can move more.
Lift the ear up too much. It'll displace the ear. That'll look bizarre. During that process, we're trying to also pay attention to what we're doing to the normal facial features. We don't want to tug on the eye excessively or the eyebrow or the ear. Symmetry is a big part of reconstruction. If you kind of reconstruct something and get something closed, but it's not symmetric, what have you done? Part of the problem is that it's really tight. You can't get too crazy with it.
As doctors, we're constantly faced with this like risk-benefit ratio. I want this closed, I don't want to graft, but is it too tight? Should I stop here and say, okay, let's just be safe and put a graft on?
It's tight, man. I don't think you're gonna close this. It's too tight. In the middle, you're gonna need a skin graft. There's no way around it.
There's a ticking clock to all of it, and you got to figure out right then and there, and there's no way around it.
Can we just feel? Can we see how tight that is? It's tight, man.
Let me try this, because you see this point here, if I could get this released enough around the here, and then it could go to there. We are in the middle of Jordan's surgery, and I'm just trying everything I know how to do to try to close the skin. I have a skin graft as a bailout, but I'd love to try to avoid it. This is so close, man.
Yeah.
I think if we release a little bit more, it may come.
You could always do a little back cut right at the hairline.
Yeah, that'll work for sure.
And I think you'll still be able to close like this to this. That way you don't displace the ear either.
Yeah, it should be okay.
Yeah, I think so.
I'm waiting on Jordan to come out of surgery. I know she's been wanting this for a long time, and I just hope that it's going to be everything she wants. If the birthmark is removed completely, that's a bonus, but my main concern is her health.
If we were to get a little bit more laxity, we would recruit this way.
Bring that back down there. If I keep going, I can get this closed, but we're struggling to fill the gap. So we detach it from the ear, so that way we can leave the ear in place and move the skin around the ear.
It's getting there.
That's actually not bad. Took a ton of work, a lot of dissection. Cool. And finally, after a lot of effort, we bridged the gap that the birthmark created without a graft. We got everything closed, and it looks great. This is kind of a big deal, and really happy for that we were able to get the skin closed here, honestly. It's a huge win. It's a huge victory for Jordan because, honestly, in my heart of hearts, I thought there was a very low chance that we'd be able to get this done without a graft, honestly. But if it came together and it didn't feel too tight and wasn't overly distorting, and I felt really good about it. So the next step is get this biopsy of that mass we found in the imaging, and we're done.
There we go.
Thank you. Thank you, Andre. We're gonna give it to the pathologist to fully diagnose it. Hey, Marion.
Hi.
How you doing? You doing okay?
Nervous wreck.
Yeah, so everything went great. We actually got it all out without using a graft, so that's gonna look so much better, and I think it went about as good as it could have.
So the biopsy, what did it look like?
So it was actually a mix of bone and soft tissue, but I think we need to figure out what it is and make sure that it was nothing malignant that's gonna harm her and, cause problems, okay?
Okay.
You never know if there's some cancer harboring inside of it, and I want to make sure it's not a malignant tumor.
Can I give you a hug?
Yeah, of course. Yeah, please.
Thank you.
Andre deserves one too, because he was there for every step.
It's a pleasure.
All right. And if you need anything else, let us know, okay?
All right, thank you.
Life is full of big occasions, but sometimes it's these moments in the here and now that are just as special. So savor them together with the delicious multi-layered experience of Ferrero Rocher. Ferrero Rocher. Get wrapped up in the moment.
Who do I trust for business insurance?
If you need business insurance, join nearly 1 million customers who trust...
McDelivery? You in?
I'm in.
I'm in. McSpicy. Medium meal.
Yeah. I'm in.
I'm in. McCrispy.
I'm in. Yeah, I well fancy a fillet of fish. Expand your palate. We're in. Mac delivery.
Big chicken sandwich. I'm in.
Oh, I'm out.
Get hosting sorted with Black Friday deals on the UK's best broadband technology with full fiber 100 that can actually handle the extra guests this winter. It's fast, reliable, and only $26.99 a month. We'll even give you up to £300 towards early exit fees. So switch to EE today. Offer ends 11th December.
AutoSerge automatically checks for ways to save on your car or home insurance. They compare the market app, the simplest way to save.
Emergency at 23, EFA's extended family. Cause you get a rewind, nappies, coffee, rolls to go. Names, dates in a hot mess. No chili, it's an SOS. Major cook up, we saw ya. Let me call the reinforcements for ya. If somebody say just eat.
A lot of my patients who have sensitive teeth want a whiter smile. Sensodyne Clinical White has been clinically proven to give 2 shades whiter teeth and to help protect sensitive teeth. People with sensitive teeth don't have to compromise on having a whiter smile as well. I would absolutely recommend Sensodyne Clinical White to my patients. It's a winner all around.
Daisy, Mark Jacobs.
Kevin the Carrot arrived fashionably late. Katie and the guests just had to wait. A delicious selection of canapes was there to make this the most special of days. From just $1.99, that's far from dear. But would Kevin be voted Rear of the Year?
Yes, gang! It's Black Friday time! Here, look!
Hey, there's the Asus AMD Ryzen processor laptops from £199.
And the Beats Solo 4 wireless headphones, only £99.
All your Black Friday deals for fashion, home and more. Plus more time to pay with VeryPay. Very, let's make it sparkle.
Save up to £788 on some of our top Android devices today, because powerful AI deserves the UK's best network. Talk it out live with Gemini. Just point your camera and ask away. Like help customizing recipes or recommending new dishes to try. And get more done with Gemini on the Honor Magic V5 and its ultra-thin fold-out screen. Get big savings on Android with EE. Offer ends 24th of November.
Thanks, Dad.
Don't worry, I got you. Pull out.
That's life.
I got this, Dad.
That's what
There's a car.
You're riding high in the road.
You can go.
You know I'm gonna
Good job.
that too.
Oh, watch out, Dad.
Meet the refreshed Volvo XC60 with driver support.
That's life.
The arrest is the pivotal moment in any investigation. If you get it wrong, then it's game over.
You're under arrest on suspicion of conspiracy to kidnap.
Who? Holly Willoughby.
Get in the ground now!
These arrests happen in seconds.
Police!
Now discover the raw and unfiltered journey to get there. Brand new Inside the Arrest. Friday at 10 on Really or stream on Discovery Plus.
We had 5 letters.
Steps.
This is Layla's jacket. Boom. 1, 2, cha-cha-cha.
Brand new Celebrity Yorkshire Auction House. Stream the latest episode now on Discovery Plus.
Hey, babe.
What's up, Dad?
You doing all right?
Yeah.
You're prepared?
Nah, I'm stressed. Today is the day of surgery, and I've been waiting for this for a very long time.
You should be
Anxious.
fine. You're good.
There is stuff to be nervous about, but at the same time, I trust Dr. Ravello to do what she does.
Surgery days are my happiest days. It's why I'm a doctor. It's why I'm a plastic surgeon. Being in the operating room, doing surgeries, that's why I'm here. This is a very complex case, but it's why I do what I do. What makes this case scary is that the anatomy is not normal at all, and I suspect that we're going to see a lot of scar tissue. What we are looking for is viable, usable muscle that we can use to recreate the corner of the mouth. And what I'm looking for might not be there.
Hey, it's good to see you again.
It's always helpful to have an extra pair of hands and an extra mind in the OR. And so Dr. Roostaeian is going to come in and help with the case. So let's open this up here to start.
Okay.
All right, incision. So the first step that we're doing here is releasing this scar of the upper lip. So right now we're just working our way through some pretty dense scar tissue. In surgery, we use an instrument called Bovie electrocautery that burns and cuts through blood vessels, and it burns the end of the blood vessels so that they don't bleed.
So what are you guys smelling right now?
Burning flesh. I love it. I love the smell of the Bovie. Who doesn't love burning flesh in the morning? I do. I really love this smell. I'm not quite sure what that says about me, but for me, it signifies being in the OR. It means that I'm doing something I love, and I don't particularly find it very alarming.
Okay, now it's starting to barbecue.
That's getting a little smoky.
Notice, like already, just by releasing this, the lip has now dropped close to the right level based on what I'm seeing on the teeth.
Which is really promising. Things are off to a promising start. It was such a satisfying feeling because you could literally see it on table as it was happening.
It's awesome.
All good things.
I'm waiting for Lewis to get out of surgery. A little anxious,
Shelby's definitely worried about where Lewis is at because she's normally always with him. But I feel like it's in good hands with the doctor.
That's good. That's down to almost the corner there.
Mm-hmm.
Now that we've released that scar, there's a big gap. We're missing skin. So we're gonna take skin from behind Lewis's left ear as a flap. We leave it attached to its blood supply and rotate it into the position we want. We have to be really careful because if that blood supply is not maintained, the flap can die. Very cool. All right, so now we're at the part of the surgery where we're going to see if we can actually do any kind of reconstruction of the corner of the mouth. The first thing we do is release the scar and the skin alongside the corner of the mouth. We have found the edge of his orbicularis oris muscle, which is really promising. That's what we were looking for. I reconnected the lower lip muscle to the upper lip muscle so that it can now work better as a functioning muscle.
Definitely better.
1 or 2 stitches and we're closing.
Uh-oh.
Oh gosh. Well, that's a problem.
We thought we're done with the surgery, but then we take a look back at that first step that we did with the flap, and it was white, which isn't good. That means it's not getting adequate blood flow.
So this part was bleeding when we cut it.
Right.
Yeah. This is absolutely the last thing we want to see. We need one more.
If we don't get this fixed quickly, it could, ruin everything.
We've finished our surgery, but our flap is not getting blood supply. We need to get blood back into this flap as soon as possible. So we are releasing some of the sutures that we placed. We repositioned the flap so that it was not under such a tight closure. And one other thing we did was we used a nitroglycerin cream, which allows the blood vessels to become larger, which allows them to carry more blood to the area. We're holding our breath until we see some return of color to this skin flap. Kind of looks like there's something there.
See a little pinkness there, yeah.
Oh, thank God. And finally, we do see some return of color to the flap. When we press the flap with our finger or with an instrument, it blanches. That means that it goes white and then it starts to get color back to it. That means blood supply is returning. This is great news. This is what we need.
Clear. There you go.
Sweet! Yay! All right, we're done. So we finished the surgery. We had a little bit of a hiccup there at the end with the flap, but we addressed it. We got return of blood supply. So I'm feeling good about this surgery.
Good job.
Lewis is coming today for his follow-up, and I'm very excited to see how he's coming along. He's bringing Shelby, of course. They are the dynamic duo. What I really want to see, what I really, really want to ask Lewis is he able to close his mouth? Can he kiss his wife? And does he have any more problems with eating or drooling? Hello, hello. Oh,
Hey,
hello.
how's it going?
That's going all right. How are you?
Doing great, doing great.
You look amazing.
I know.
Well, tell me about this goatee. This is a new thing.
I used to have it before the crash, right? And then I tried to grow it after, and it didn't look right to me. So
and are
then,
you starting to grow hair back in that area that we worked on?
it's like a couple of spots, maybe 4 or 5 hairs that grow out of the actual skin graft.
Okay.
But I think because it looks odd just having a few hairs, I just,
take them off.
To me, it looks better this way because at least it's groomed.
I love that. All right, well, let me take a look at this up close here.
For sure.
I want to look at the corner of the mouth.
Okay.
I know that's the part we worked on pretty closely. Close as much as you can. Hey, look at that. I told you to keep your mouth closed.
Girl, I love it. It's going to make me smile because it just makes, it's like the best compliment in the world right there, I tell you.
Tell me about the moment when you first realized that you had achieved lip seal. Tell me about this moment.
The moment I noticed the lip seal, I was just brushing my teeth like I do every day. I didn't hear any water coming out. I turned down, I looked down, I'm like, yes! I was like, I still think this is a friggin' dream, and I'm gonna wake up at some point I was not able to kiss my wife. I would end up drooling on her. I can kiss her, and no drool came out. It was the happiest moment for me. Crazy.
Well, it's been my absolute pleasure, and let us know if you ever need anything else.
Appreciate it. Can I give you a hug?
You sure may.
Heck yeah.
Please.
I give you a hug.
All right. You are welcome. So today, Lewis sent us a home video. You guys want to watch?
Let's do it.
All righty.
I love these.
I know.
And that Chopster is the most famous dog in the world.
No doubt.
Now I forgot what I was doing again. Hey, Docs. How you doing? It's Lewis here. I'm doing fantastic. 1, no more drool out the mouth, which is great. 2, Shelby's not so happy with this. The food doesn't fall out no more, so she can't eat it. I also can kiss without drooling on people now, which Shelby doesn't mind because she's a puppy love. I'm ecstatic with the way my face looks. It looks great.
Oh, man.
What a guy.
He's so positive and so excited that he can fully close his mouth now. You know, that he can keep food in, he can kiss his wife. All these things that seem like small things, right? But that's so much of your life, and to have it just be so transformed, it's huge.
Pretty cool.
Yeah, it's quality of life.
Quality of life.
So we got Jordan Lopez coming in today. She had that really large birthmark, and it was really difficult to get it all removed in one stage like that and get everything closed. So I have her pathology reports from that biopsy, and I'm gonna give her the results today. I wanna see that we're able to get all of that lesion removed and none of it came back. Jordan, it is so good to see you.
So good to see you.
You look fabulous.
Thank
you look
you.
amazing, seriously. You mind if I get a closer look?
Go ahead.
Awesome. All right, so, oh, that looks awesome compared to the, the thing that was growing out, right? Remember, I think we called it the Texas-sized birthmark, right? And the shape of Texas. And now, obviously, the birthmark's gone, and now you could throw your hair back, especially in...
Yeah, that's another thing. I mean, I've been wearing my hair however I want to. I don't try to cover it.
How do you feel about it?
I feel pretty good. I feel
Yeah?
Jordan 2.0.
2.0, I love it.
The headaches, completely gone. Remember, they were coming like every day, constantly. No more. I have no troubles with going to sleep anymore. It doesn't itch.
That is
at
awesome.
all.
I remember you had the birthmark and the cyst in the upper eyelid. That's healed beautifully. Your eyelid looks really good there. I know the vision's not great out of that eye and still difficult to open, but that's something that can be addressed in the future for sure. And I know you're really eager to know the pathology results of that mass, especially the one in the nose.
Not knowing what it is can be scary. What I fear the most is it being cancer.
It's benign. So that means you don't have to do anything about it unless it changes over time, which I really don't think it will.
Thank you. I was really worried about it because I was like, what is this?
Yeah.
What is it?
Yeah. The birthmark, I couldn't be happier with that.
Me neither.
You know, like it's all your skin, no skin grafts, nothing like that. And the incision's healed beautifully. Scars mature and get better and better over the course of 2 years, really.
Yeah.
It's a long, slow process, and you're just in the baby stages, but we're sitting really pretty, honestly.
Thank you.
Okay? You're welcome.
the best.
Yeah, you're welcome.
Dr. Roostaeian and I have an incredible bond. He's very understanding, and he took all of my concerns into consideration. And I'll be forever grateful